Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Are you struggling to lose weight and keep it off? Tired of wasting time and money on starvation diets that lead to more frustration and stress? If there was a weight loss solution that could actually work for you, would you try it? Then head to Golo.com.
I'm Steve. I lost 138 pounds in 9 months on Golo.
I'm Amber. I've lost 128 pounds with Golo Taking Release.
If you're ready to take back control of your life, head to Golo.com now and see how Golo can work for you. That's GOLO.com.
My sleep is way better. My inflammation has gone way down. Golo saved my life. I was way overweight. That's what sent me down the path. I wanted to make sure and live for my kid.
I have literally tried everything. I was on the verge of getting gastric bypass surgery, and I saw the Golo commercial, and it was the last thing I tried because it worked.
Join over 2 million people who have found a better way to lose weight with Golo. Your healthier and happier life begins at Golo.com. That's GOLO.com. Again, GOLO.com.
Welcome to Handle with Care, Breast Cancer and Beyond, a safe place where both women and men can come and listen to real people talk about their breast cancer experience and the effects that follow well into survivorship. Hosted by Carrie Madrid, a stage 3 breast cancer survivor and founder of the CARE Project. It's time to Handle with Care.
Hey everyone, welcome to Handle with Care, Breast Cancer and Beyond. My name is Chris Donovan, and today on the show we have a really cool guest. His name is Ed Lobaugh. He joins us today to talk about medication, mental health, and how depression isn't a choice. And if you or anyone you know needs help or wants to talk to someone, please call the suicide hotline, 800-273-8255. This one runs a little long, but don't worry, it's worth it. Enjoy the show.
Hey everyone, thanks for joining us. This episode is all about mental health. We often hear the phrase mental health matters, and it really does. So we're going to talk about that today with our special guest, Mr. Ed Lobaugh. So let me give you a little background on Ed. I met him because he's a great friend of my Aunt Susan, and I was on a trip recently to help take care of her after her breast cancer surgery, and we just got to chatting, and I was like, oh my God, I got to have you on my show. So Ed is a board-certified psychiatric nurse practitioner. That's a mouthful. Holy crap. A graduate of University of New Mexico, and he's experienced in treating children, adolescents, and adults. He spent the last 20 years of his life caring for people with both medical and mental health issues. So obviously a perfect fit for our podcast today. Ed found his passion.
Are you saying we have mental issues, Carrie?
We do. You and I, we need help. So the last thing I'm going to say about Ed before we get into it is he found his passion for caring for people with mental issues while working in the ICU, which I found fascinating. And it was during this time he found his calling, helping people face death and dying and or life-altering health issues that affect their mental health. So that's a mouthful, but oh my gosh, what an incredible life you live.
Yeah, I'm having like a little flashback of being back in the ICU.
Yeah, so tell us about that experience. How did you land working in the ICU?
Well, ever since I started nursing school, I knew I wanted to work in the intensive care unit, and I wanted to work closely with people. I just like that direct patient care. And when I finally got to that point, I worked in the step-down unit for about 6-8 months at one hospital and then transferred to another that offered the intensive care unit training. And when I'm working with people, I just found that, God, it was an emotional and spiritual experience, holding their hand sometimes while they're on a ventilator and struggling to survive.
I've sat with patients, breast cancer patients in particular, at the end of their life, within hours of dying, and I always say, what a privilege, what an honor, But it is a spiritual situation for sure. How do you personally prepare to cope with that, like over and over again?
It's hard. You get attached to the family members. Some of my clients were in there for 3 to 6 months in the ICU.
Wow.
You got to know them really well. And, they would bring in personal hygiene products, to bathe them and take care of them. And you get to know their little nuances about their family, sometimes see their kids. Yeah, I've helped many spouses just deal with, the end of life issues. And then also just being a great patient advocate. You have doctors are coming in and out and offering different types of treatment, and they hear their diagnosis, whether it's cancer or something else, and you just see, those headlight eyeballs that staring in the headlights, and they just like, oh my God, what just happened? And so I just remind them, it's okay, let's take a deep breath. Why don't you think about it a little bit? And then I'll ask them to come back in here. And then sometimes doctors were great about it and sometimes they weren't. So I just get on the horn. I'm like, you're getting your butt back in here. You've got more to say to this client.
So I was just going to say that I personally had a pretty good experience getting my, like having my diagnosis delivered, right? And coming out of surgery and hearing more bad news. But I have talked to a lot of patients that had horrible experiences. And so I think having somebody like you there as their advocate, that's priceless.
Yeah, I really enjoyed that. And I'm not sure what the words are, but I just felt honored to be present in that family's trauma, the life-changing event, and to prepare and keep going. Sometimes it was difficult. You'd lose a patient at 1:00, and then the ER would call and say, hey, we're admitting 2 more. And I'm like, okay, I need 5-10 minutes. I need to go for a walk. Maybe I need to go in the closet and cry for a few minutes and then come back. So, and then at the end of the day, I'm just like, because I would work 12-hour shifts. I'd just go home and, I'm going to bed and just sleep it off, because that was the best thing to do.
As I say, mentally, you have to be drained if you're working 12 hours and potentially lost a couple people each day. I mean, I couldn't even imagine.
Yeah, it is intense. You're sometimes just not ready for the next client. You have to be. I mean, you're assigned, you're there for 12 hours. It's your job, and that next person needs you. And I worked in a great environment with really supportive nurses. So we took care of each other. If you said you needed a few minutes, the other nurses would like, oh, I'll go get your room ready, and I'll even take a report for you, and then come right back.
Yeah, I would imagine that you just sort of spring into action, right?
You do.
I mean,
It
regardless
comes
of how
automatic.
exhausted you are, right? I mean,
Mhm.
because physically you're exhausted, like Chris said, and then emotionally that just adds to it. I know sometimes, like when I would host a support group of sorts at the Care Project, I go in, I feel great. I feel great when I go home. But then I realize after I get home after an hour or 2 hours with these patients that I'm like exhausted, and I'm like, oh my God, what's wrong with me? And then I'm like, oh, it's the emotional. Even if I wasn't necessarily emotional, I find like I take on everybody else's emotions.
Yeah, it's part of being empathic, right?
It is, unfortunately for me. I didn't realize until about 3 years ago that I kind of had that. Yeah, it's a good and bad thing. You just got to learn to manage it. And I haven't quite mastered that yet, which is one of the other reasons that when we got to talking at my aunt's house, I was like, how do you handle it? Right? Because I have to find a way to protect my space and yet still be that personal touch for the people that I serve.
Yeah. I mean, over the years, I've just learned that, hey, I need to do some type of physical exercise almost every day,
Mm-hmm.
and I need to get outside. So, I mean, lately, even though it snowed today
Oh my
here in New
gosh.
Mexico, it's already gone. It melted, but I was out there before it was snowing. I'm like, okay, I'm walking my 4 miles, getting ready for my next, my first client of the day. You got to keep that balance.
And I think that that's something that I think we'll get to, that whole exercise part in terms of one of the coping mechanisms. But,
Hmm.
so I wanted to just say, people are probably wondering, like, this is supposed to be a breast cancer podcast. Why are we talking mental health? It's so relevant, right? And besides, it's called breast cancer and beyond. And this is one of those beyond topics
Hmm.
that I think people, once they listen, will realize this is so valid. A lot of cancer patients I know, because I'm one, and I should say survivors, we deal with PTSD from the trauma that we faced, whether that was losing a breast or losing a limb or losing your hair or whatever, right? And then for me, I almost lost my life a couple times. I thought in the moment I was fine, but then, it unfolds later that I call it the aftermath. And that's when I realized I had kind of gone to some dark places. So there's 2 reasons I wanted to have you on in particular. Well, more than 2 reasons, but 2, how do you say it? categories, if you will. Personally, I know and love people that have been diagnosed with clinical depression, have been suicidal. And I also dated someone who, a time after we broke up, maybe 2 years, it's kind of blurry for me, he actually committed suicide. And that still had an effect on me and obviously his 3 grown children who I was very close to and our mutual friends. And then also professionally running the Care Project and dealing with breast cancer patients, a lot of us have gone to a deep, dark place following completion of active treatment. When everybody says, oh, ring the bell, you're done with chemo or radiation or whatever that is. And now everybody just expects that you're back to normal, whatever that is, and that you should be so happy and so grateful. But what I found in the last 6 years of running the Care Project is that's the time where we need like mental and emotional support the most, because I think that fight or flight has sort of worn off, if that's a thing. Because now we're done with the job of going to this appointment, going to that treatment, completing that surgery, recovering from that surgery. And then they send you home and go, we'll see you in 6 months. And you go, well, shit, now what? Because you get a headache and now you think you have brain cancer, or you don't know how to function without people checking on you. So that's really, I think, how this all ties in. And I think that it's really important for loved ones and friends of cancer patients in particular that I deal with to know that this exists. This depression happens, right?
Absolutely. From the moment you're diagnosed, you hear the word cancer and you think, where do you go? Most people think I'm going to die, or this is going to be really grueling treatment. And it has horrible side effects when you start thinking about chemo. And I think for me, when I was in the presence of a patient that heard the word cancer from their oncologist that came in, or whoever the specialist, they just shut down. They didn't hear anything else. They were not good for the next day or so. So that's why it was important for them to come back. And these doctors often didn't get it, especially surgeons. I mean, they do a great job, right? But they are not a people person. They're a mechanic.
We talked about that. I say that all the time. I was very fortunate that the surgeon I had was the chief of surgery and his bedside manner was impeccable. He was just like, oh, honey, and I was like, oh, no, I'm good. And he was like, no, you're not. And I was like, no, really, I'm good. Are you okay? Because he was so sensitive and so sweet. But most surgeons, and patients will come into the Care Project and they'll be so pissed and they'll be venting about an experience with a surgeon. And I let them vent. And then I say, okay, but do you love your oncologist? Are they sweet and loving? Yeah.
Right.
And that's all that matters. Because guess what? Your surgeon's there to do the job, and he did the job or she did the job. Let it go.
And they're experts. And I think that's part of their mental health.
Oh, for sure.
They may lose patients occasionally, and they can't get too attached to keep doing their job. So they get a little hardened, and I think it's protective.
You mean it's not all like Grey's Anatomy where everybody marries everybody else?
Oh, heck no.
Okay. Well, I'm going to have to tell my wife that. She can be disappointed.
But
another thing that we've talked about before too, Carrie, is that when people do go and get these results and get diagnosed and hear the word cancer, she's always mentioned, and which I really would have never thought of, except my wife's amazing, is take somebody with you. If you don't have someone, just take someone, because as soon as you hear those words, you're going to blank out, and that other person's going to be sitting there taking those notes and getting those notes, and hopefully they're retaining everything that the doctor's saying to you, but you're sitting there probably just out.
Yeah, I think you just go to, a lot of patients describe it as like listening to Charlie Brown after a time. You just hear wah, 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 wah. After a time, once you hear cancer, it's like, what? I mean, I remember when I got my diagnosis and my best friend was with me, and there was a time he gave me the diagnosis. He says, hey, get dressed, come across the hall to my office. We'll talk, scheduling and what we're going to do next. And I was like, all right. And she was like, how can you be so calm? And I was like, it's all right. We got in there. And I said to her, as long as he doesn't say infiltrating ductal, we're good, or invasive, right? Because I'm a trained medical transcriptionist, I knew what those terms meant. She's like, what does that mean? I was like, don't worry about it. As long as he doesn't say that, we're good. What came out of his mouth?
Oh my
invasive,
God.
Infiltrate. I was like, she's like, shit, Then she went to want, and I was okay. But that's just because of the background I had. But everybody's different. And it is so important to take somebody with you. and if possible, two people, because one of them's probably going to be super emotional. But if you can take somebody who can be like steadfast and collected, they're still affected, but they can put it aside for that moment. That's super important.
Plus, you might need one to prop you up.
Yeah, that's a good point. I do think it's a really good idea. Anytime you're going in for an evaluation and you think you're going to get a diagnosis of something, you should have someone else there to kind of support you and listen and take notes.
And, in this COVID time, we were really worried about that with my Auntie Susie and me showing up in New Mexico to go with her, but they were really good. They were really good about, because she just let them know, look, my anxiety is off the charts and I'm not going in if she doesn't go in. Of course, she threatened them a little, but it got me in.
That's the family way.
That's the family way. Us Madrid stick together and we'll beat your ass if you don't let us in. No, it was good though. It was good. I think it was helpful in that she could say to them, look, she's a survivor herself and she's going to be taking care of me.
Yeah.
So, and she, her well enough to know she didn't hear anything after they said cancer.
Absolutely. I'm glad you were there with her.
Yeah. And I'm probably going to need some therapy after that because I've never been a caregiver.
Oh, really?
Well, for my father, but not another breast cancer patient. And so that was quite a different experience. So we're going to do a show with her too.
Oh, that'll be great.
Okay. So let's talk about depression. Okay. I want to know, like, technically, what is it? How do we recognize it in ourselves and others? And I say ourselves because I think there's a lot of us, and I say us because I was one of those people that didn't even realize that I was in a depression, because after I finished radiation and they sent me home and said, see you in 6 months, I literally collapsed on my couch for 3 weeks. I didn't want to talk to anybody. And anyone who knows me knows I talk my ass off, right? That's why I have a show. I didn't want to talk to anybody. I didn't want to text anybody. I didn't want to play any online games. I didn't want to do nothing. I sat on my couch for 3 weeks, feeling like shit physically and emotionally, I think depleted, because I had tried to stay strong for everybody else around me, that I just sort of like, whoa. I melted into the couch for 3 weeks. I ate whatever I wanted because I finally had taste buds back. I gained oh my gosh, in 3 weeks, I probably gained 15 pounds and I felt horrible. And I thought to myself, I've been here for like 3 days and I haven't showered. This could be a sign of depression. I think a lot of people don't realize they're literally depressed. So can you talk a little bit about that?
Oh, absolutely. Depression is pretty complex. It's a culmination of symptoms, and you've pretty much covered them all. Changes in appetite, whether it's a decrease or an increase, that is a symptom. Feeling lonely, isolating from others, that's a huge symptom. Feeling more tired, changes in sleep pattern, lack of motivation, like you said, to the point that some people don't even care to shower, or get out of bed. So, and then, in comes possibly, not for everybody, but they have suicidal ideation. So, and that comes in varying degrees, right? People have thoughts, they have dark thoughts. Sometimes they just think, oh, maybe it's better off if I'm gone, I'm not here. If I walked in front of a bus and I'm gone, that's okay. But then it goes to different degrees of people thinking about plans, and then beyond that is they can develop actions.
That's important. I hate to interrupt, but I will, because I have chemo brain, and if I don't say it when it hits me, I'll forget. But I think it's really important, like what you just said, in terms of having suicidal thoughts. Like, I've gone to a place where I felt like why did I live through all of this to now feel like this, right? I lived through all this torturous treatment, if you will, near-death experiences with a staph infection, ending up septic in ICU for 11 days. And just to go back a little bit further to what you said about feeling isolated, that you see a lot of breast cancer patients, and I'm only speaking breast cancer because that's what I've experienced, but you see these cancer patients like online and on commercials, and they have this big band of supportive, friends and family, and, oh, we'll shave our head with you. But guess what? I'm here to tell you from experience, and experience of my friends that are survivors, that even though you may have 30 people surrounding you at all times and texting you, you can still feel very alone and isolated, right?
Yeah, I think what goes on in your head is is incredible. I mean, I think some shame can go in there, some guilt. What did I do wrong? What did I do to deserve this?
Hmm.
And people get really kind of quiet about it. They don't want to talk about it because of that shame and guilt. And, it's a medical diagnosis. You didn't do anything. It just happened. It's part of life. But where does our head go?
Right.
It's a crazy place where we go. And then what do? We shut down. We don't talk to anybody. We don't reach out. And yet
Yeah.
we may be surrounded by really close friends that we could tell anything to, but this just feels,
This is
way
why
over the
we
top.
have absolutely, and this is why we have the Survivor Social Club at the Care Project, because there are patients that are part of this club, and basically it's just a bunch of survivors, and we hang out when we can, and now
Hmm.
we have to Zoom when we can, and it's just people that would never be friends outside of this diagnosis. Because they simply wouldn't be in the same circles, right?
Right.
But we all share the same common bond in that we experience cancer and all that goes along with that.
We're actually coming up with the physical version of that show for the podcast called Whining with Care.
We are. We are. Maybe we might need your intervention on that one.
Yeah.
We
So
might need some cheese.
Yeah, it's just important, I know, to have despite having a bunch of family and friends that are supportive, it's so important to have someone else who's been there, done that. And
Yeah.
that's about the time where people say, I felt so alone. And then they feel guilty about feeling alone because they have this great supportive family, right?
Yeah. It's again, it's just really complicated. And the more withdrawn you get, the deeper you get into your depression, the more sad. Your brain just kind of shuts down and doesn't do the normal things. Like you said, just going out and hanging out with friends. Not to mention, you have cancer now, breast cancer, and just the physical symptoms that you may have that make you tired. You're in pain. That kind of drives your depression even deeper.
yeah, I can imagine you being mad at your body for doing that. It's like your mind's
Yeah.
like pissed. Like,
You get
why am I?
frustrated.
Yeah, I can imagine. Like, okay, I've gone through all the treatments, I'm cancer free or whatnot, and now I'm pain here. I got pain here. Like, what the hell is happening?
Yeah, and in my mind, one of the things was I fought my weight my entire life. And so, way before I was diagnosed, I worked in a chemo clinic like 20 years prior. And so, obviously, from that time to when I was diagnosed, there's been significant improvements in managing, the vomiting, the nausea, the diarrhea that you always see in the movies when someone's having chemo, right? Well, I
Hmm.
didn't just see it in the movies. I saw it in those patients where I worked.
Yeah.
So once I was diagnosed, I was like, oh my gosh, if there's a silver lining, I guess I'll lose 25 pounds, right? No, I gained 45 pounds.
Oh, wow.
And that's what normally happens. And I think a lot of people don't realize that, and so that in and of itself is depressing, frustrating, all of that shit. But this isn't all about me. So let's move on.
No, but you bring up some really good points. You talk about body dysmorphia. I mean, if you have a lumpectomy or total breast removal, I mean, that's a huge change in the way you appear, the way you see yourself in the mirror, and then all the identification that goes with that. If you were married or have a partner, it gets really complicated, and that can drive the depression.
And then there's those of us that are single.
Hmm.
So when I was diagnosed, I was dating somebody. I was in a very serious, newly serious, but a serious relationship. And great guy, very loving, very sweet, was there the day I had my surgery, was the last person I saw. He sat in the waiting room with my parents. But when I got out, he could not handle it. Emotionally, mentally, I found out later, he was terrible in a crisis through his family, and he just disappeared. Like the next day I came home from the hospital, it was Valentine's Day.
Oh boy.
Sheesh. I don't like
Timing.
I don't like Valentine's Day too much. But
Ouch.
he just disappeared, and he always would go out of the country for work. And so about 3 weeks later, I got a call from him. And by this point, I had started chemotherapy. So I was like drunk on chemo. Like I would moved on past that. I didn't have time to worry about him.
Right.
And he just said, I'm sorry, I couldn't handle it. And I was like, yeah, no, I can't handle you right now. So wish you well, but we're done. And unfortunately, that is the same gentleman that ended up committing suicide. I want to say it was a couple years later, and he had a lot of emotional stuff, obviously.
Yeah.
God bless him. He tried his best, but I just think to myself that what a blessing in disguise for me, not that he hurt himself, but the fact that I wasn't in his life at that time, but that was another survivor's guilt. I had to deal with that.
Oh yeah. I can't imagine the middle of that, or just, the beginning of chemo and then he just disappears.
Yeah, so there's a lot of survivors that there are those that are married that end up divorced. I've had a patient that have said she's actually a 2-time survivor, and the first time she was diagnosed, her husband told her, well, now you're only half a woman, because she had one breast removed.
Oh, that's
And
mean.
like I can't remember. It was like at least 5 years later, she was diagnosed again in the other side. And so she had the second one removed. And then he told her, now you're not a woman at all. And he left her. So there's, you run the gamut. The other thing is the anxiety that is for single survivors now who have to try to navigate dating.
To make it worse, let's throw COVID on top of that, right?
Let's throw COVID on top of that. Now you want a COVID date.
Yeah.
Right. Oh my God.
Gosh, I need wine right now, guys.
Well, you don't have to drive
like,
anywhere.
how do you? I'm not dating. So how do you do that? I mean, is that Zoom dating or is that FaceTime?
I will say this though, before anyone gets like, oh, that's stupid. Let me tell you something. It's a great way to weed people out.
Right?
I would think so.
You don't have to
Less
get
risky.
all fully dressed. You don't have to go anywhere. You don't have to have that awkward, I'll meet you at Starbucks and then you're looking for them and are they there? You don't go through any of that.
Yeah.
You show up and you weed them out, because if they don't want to Zoom or FaceTime you, they're not good for you.
That's hilarious, though.
True.
I know. Now we've gone into the dating show.
Well, yeah, no, yeah, we have a show.
Bring us back, Chris.
I was actually editing a show today, and it was just on the suicide note. The guests of the show, his father had committed suicide when he was a young child, so he hadn't come to terms with that until he was in his mid-20s, because he just kept himself busy and kept ignoring it and stuff. Do you think doing that, ignoring it and coping with it years later, or coping with it right away is better?
Well, I think the studies show that it's better if you deal with it right away. The longer you kind of brew on it, sit on it, it gets a little more complicated, especially when you're talking about PTSD. They say the earlier intervention, the earlier the treatment, the better prognosis and recovery.
Okay.
So, I mean, for all, the clients listening here today, and if they're going through this, hop on that. Don't be afraid to get in touch with a mental health provider. You don't always have to do medications. There's therapy. Just being able to talk to someone is a huge help.
Do you think it's better to talk to a professional or to a friend?
It depends on your level of depression and where you're at. Depression is not just cookie cutter. It is very unique to that individual. And then there's mild, there's moderate, there's severe. Severe is more suicidal, getting close to attempting, if not attempting. Moderate, somewhere in between. So it really depends on that person. There's a lot of people out there that are not comfortable with reaching out to mental health. There's such a stigma about it. And
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
I hope we get a chance to normalize it. Everybody needs somebody.
That's what I was just going to
Yeah, I
say
agree.
is, too, there's a lot of, that was another angle for doing this show. And hopefully we'll do a series with you, because we do want to erase the stigma, and especially in specific cultures, a lot of times, and I'm just basing that on the clientele that I have through the CARE Project, we deal with a lot of people of color. And there's a lot of taboo. Number one, just being diagnosed with breast cancer, which is something you can't control, right? But then on top of that, then if you're not super strong and super this and stoic and don't cry and suck it up and all those cliche things, right? Those really are said to patients. And a lot of cultures, they don't talk about it. They don't talk about the possibility of death. They don't talk about, planning for death or estate planning or...
Death is still taboo.
It is
We don't
taboo,
talk
or
about death and dying.
we don't talk about, well, we're going to talk about that on the care on this show, because
Yeah.
I think it's important. We're all going to die at some point.
Mm-hmm.
I look at it as when someone's diagnosed with something that's terminal, whether they have a week or they have a year or 10 years, I say, and don't write me if you're angry, this is just my personal opinion. If you're given a terminal diagnosis, in my mind, that's a lot better than dying in a sudden car crash, because now you know you have a limited time, whatever that is.
You have
And
time to plan.
you have time to plan, one. You have time to say the things you need to say, learn the things you want to learn, or teach the people, whether it's your kids, your grandkids, say goodbye, tell people, mend those fences, right? So I think it all comes back to perspective in that regard. But with that said, I want to go back to the depression, because you hear people say, well, just choose happiness. You can pull yourself up. Can you talk a little bit about, like, I've heard of chemical imbalances and hormonal imbalances. Like, how much does that play into depression?
Well, it is a big factor. We're still learning. I mean, we have the old theories from the 70s and they're still using them today. We talk about serotonin and norepinephrine and dopamine and how those neurotransmitters regulate in the brain. And they're different for different people. Some people respond to a simple antidepressant like serotonin selective reuptake inhibitor. And that's usually the mild to moderate where people respond. When you get moderate to severe, you kind of need medications and a therapist. And working with the therapist will teach you the coping skills that you want to talk about later. But it also helps improve the neuromodulation. It's almost as effective as medications.
Okay, wait, what does that mean? Neuromodulation.
So that means, the chemicals in your brain are hitting the synapses or talking to the nerve cells, and they're reaching a good balance so you feel better. So it's complex, and I'm sorry about throwing that out there.
No, that's okay. So the thing is that I guess the point that I want to make is that this isn't a choice. Depression isn't a choice.
No.
Now we can choose to try our best to cope and choose to do that. I always say, that's my new phrase. I always say, I choose, to believe the best, or I choose this, right?
You talk about choosing and no one wants depression. I mean, there's a lot of influence. So you talk about getting a diagnosis of cancer, but let's talk about them growing up and, what type of household did they grow up? Did they have good coping skills with that family? Did they know how to support? What was their environment? Was it an abusive environment? All that plays into it, because that's where we learn in childhood how to cope with incredible stresses. Mm-hmm. And if we don't get that as a good foundation as a child, we're not going to do so well when we're faced with these things.
Right. Well, I think I want to touch on suicide a little more, because the rates have gone up, have they not?
Yeah, I have some old data, but yes, the rates have gone up. There's a huge, mission to address that. There's been a lot of education being provided to primary care as well as mental health, how to assess for suicide, because, where is depression caught? Usually with your primary care, and that's a 15-minute visit if you're lucky.
If you're lucky.
Yeah, so they're really pushing those primary care providers to screen for that. And they have some short answers, or they could print out a form where you could fill out in the lobby. They're also, insurance companies and the CDC and NIH are recommending that we do more collaboration between mental health. So
that's good.
You're seeing more primary care working with mental health providers, and actually they have mental health providers in their office now, or they're doing consulting by Zoom.
That's really great to hear.
Mm-hmm.
I know you work a lot. You've worked a lot with veterans, and you still do, right?
Yes, I do. Yeah.
How is that for you?
This is such a wonderful job. I did not serve in the military, but I feel like I'm paying respects to my country and to the men that served. And it's such a blessing and so rewarding. But at the same time, it's really difficult to see these guys go through what they've been through.
Mm-hmm.
These are pretty traumatic experiences. Some of them have been in the presence of an IED or some bomb explosion. So their PTSD can be a little more complicated because you have that concussion sound affecting them, and sometimes they lose consciousness.
Oh,
I just
wow.
thought about other like frontline workers now with COVID, right?
Hmm.
Regardless of what people think about COVID and their whole political views, the bottom line is there are frontline workers, nurses, people that are cleaning up the rooms, the doctors. I mean, man, what's the best advice you can give to them to get through what they're witnessing?
Take care of themselves. It really is about self-care. I used to kind of poo-poo that.
Right. I think a lot of people do. I think a lot of people hear that as a buzzword or a buzz term and think, oh, how indulgent. But it's really crucial.
Yeah, I agree.
Yeah. And ever since I've been in mental health, self-care is brought up almost on a daily basis. And so it's almost too much. But at the same time, it is really essential that you get a plan that works for you and tailor it. Take some time off. And those nurses that are working long hours, like, try not to sign up for too many extra shifts. You need your time down. You need to rest. It's not all about the money. It's about the quality of life for you too.
I'm thinking of like when I was in ICU. Oh my gosh, those nurses were angels, and my chemo nurses and how they see these dying patients all the time. I just think that, like so many, and I'll go back to breast cancer because that's what I know. Like so many breast cancer survivors I know that are heads of their household, whether they're single parents or the
Mhm.
mom or the dad, we set the tone for the household, right? Just like
Yeah.
Chris being the man of his house, right? We set the tone and we got to think we have it all our shit together. And we've got to keep everything together for everybody else. But I would just implore patients and family members and whoever, in whatever situation you're in, if you're feeling overwhelmed, you need to say something. I think that that's our responsibility. We need to say something without fear of judgment, without fear of, oh, just suck it up. Like we need to be able to go to whoever, if that's our boss, if that's our partner, if that's our spouse, our adult child. I've had to go to my adult child and say, I'm about to lose my shit and I need to talk to someone that's not going to judge me and knows me. And I have cried my eyeballs out, and I was in a very dark place on Mother's Day. Mother's Day in particular is very difficult for me. I had to call my son, and really he had to talk me down because I was ready to just keep driving. I was on the freeway and I was ready to just drive to nowhere. I didn't know where I was going. And I thought, my God, I'm losing my shit right now. But people have to reach out. Chris is fortunate. He has his wife, Evelyn, who's his best friend. They have an incredible relationship. But Chris, do you feel like you can go to Evelyn with anything?
Now I do. Yeah. Over the last year, it's been a little rough for me. I had a little anxiety episode last year, and when you say, people are afraid to reach out, and but I did in a way. I reached out to my boss, my CEO, my owner, in certain ways, and told them how I was feeling. But again, those people have to act on it, and when they don't act on it and they ignore it, then it just makes it worse for everyone. But I know from that experience that I was able to talk to my wife more and tell her everything, and just be able to just basically word vomit everything out, and then we put it all together and we can talk through it together. I did go to a psychiatrist for a while, and she went with me once and stuff. So it was all from me in that situation. But yeah, now I know that it doesn't matter what it is. She's going to be able to not judge me at all.
And talk about a whole other level of intimacy, right?
Yeah. Yeah, right. Yeah. She separates my pills for me every morning.
Yeah. How did you feel? Do you mind me asking you questions, Chris?
Let's go.
Do you feel, how did you feel the first time you went in and saw the psychiatrist?
Frustrated.
Mm-hmm.
Because I've always been able to take care of everything myself in my head. And that's kind of the biggest feeling I had was frustration. I've always been the one that had the answers. I've always been able to figure it out myself. I've always been able to take care of my family. I've always been the strongest one. I've always been able to do this. And then I wasn't. And I did everything for about a year and a half. I did all the heart workup, brain. I did everything. I went to every doctor and everything I could. I still couldn't figure it out. And it came down to, stress and anxiety and just everything at work. So it was rough. Yeah.
Yeah. I think that that's me too. Like I'm a fixer, right?
Mm-hmm.
I'm a fixer. If there's a problem, I'm going to fix it. If I can't fix it, I'm going to find somebody who can. And so I know, like for me, just for instance, when I was having that meltdown on Mother's Day, I had just left my mom's house and I was trying to fix an issue there between other people in the family. And then I left and I was like, I can't do this. But I felt like I was fine until I was halfway between the Mission Grove area and my house. And I was like just sobbing. And then I was angry that I was sobbing, like, buck up. You guys know me enough. I'm a
Like it
strong
affected
bitch,
you
right?
so much. Like you were
I
so
was
mad.
I was so mad that I was so affected and
Yeah.
so mad that I had made a vow to myself that morning. My new phrase, like I said, I choose that I'm going to have a good day today, regardless of the past, Mother's Days that were difficult for varying reasons. This Mother's Day, I'm going to choose to have a fantastic day. And then I get all the way through it. And so as I was driving home from my events, I was so pissed, but I was distraught. I think I was distraught. And the funny thing is, I just picked up my phone because I was driving. I'm like, hey Siri, I'm like, call Christina, my best friend. She didn't pick up. Of course she didn't pick up. It's Mother's Day. She's with her 4 kids and her mother and doing dinner or whatever. And then I called my male best friend, and he didn't pick up. And then he called me right back. And I think I just vomited everything. He's like, oh my God, pull over. Where are you? He's out of state. And I'm like, I got to go. So then I called my son, and then I got home safely and finished talking with him for like, gosh, an hour. I was a mess. And I thought, he's going to think I'm nuts. This poor kid. But he's a grown up. He's 31. But the good thing is I realized, like, initially I was sort of frustrated with my friends that didn't pick up, like for a split second, because I was like,
Yeah.
you always tell me to call you. And I don't ask anybody for anything. I'm this big, strong chick. And then I call and you don't answer. But in the end, who answered was exactly who I needed to talk to.
Yeah. Just you being able to reach out and do that is a big deal. A lot of people can't do that.
And you know what, Chris? I almost didn't. And if I didn't, I think I recognized in that moment that if I hadn't reached out to him, it would have been not a good night. And I don't know what that means exactly, but I just knew I had felt a desperation, and I think what is distraught that I've never felt in my life.
Yeah. I
Yeah.
mean, it sounds like both of you have a lot of courage to be able to open up, and you got to find that courage, right? It's a fight.
Yeah. Oh yeah.
To
Tell anyone.
Yeah. Well,
It's
especially,
pride too.
you're the man of the house, and to admit this and share this with your wife, that's got to be difficult. And you, Carrie, to talk to your son, you've been the main supporter for the family, and just open up and share, and a lot of stuff, affects us differently. And Carrie, you talked a little bit about symptoms that kind of reflect grieving as well. I mean, that angry and the tossing and turning in your head, and I wonder, sometimes if you don't, like, what if if that goes to the brain, or can I trade this out with something else? Are you with God? Or are you with whoever your
Absolutely.
spiritual person is? I
Right.
mean, it's really complicated when you talk about the mental health issues coming from a medical diagnosis or breast cancer. You got so many things going on.
I know. See, we're going to do a whole series with you because we could delve into one thing for an hour and a half.
Oh yeah.
But I think there's just so much. Chris, what advice would you give to someone else in your situation?
I think just don't be afraid. I mean, don't be afraid to go ask for help, even if it is your wife or a stranger or a friend, or, I mean, even if it's your boss, try. Don't be afraid to go try. And if they ignore you and then they then there's not the right one, then you need to find the other one. Kind of like your phone calls. They might have been their friends. They're not like the wrong person, but at that time, the right person answered.
Absolutely. And that was my thing, is my issue was about my relationship with my children. And so who better to talk to than my oldest and firstborn, right?
Exactly.
Who helped raise the younger ones. So that was, and so when Christina called me and she was like, oh my God, like, she's my best friend, but we don't talk every day. We talk like every 2 weeks and we're good. So I was telling her about this. I said, I need to, so I did, I don't want to cry. I felt a little shame after that episode, as I call it. And so I thought like, okay, I talked to Anthony. I resolved, I didn't resolve it, but I got through the moment, right? I got through the weekend, and I thought, In reflecting back on how I felt, it frightened me because I thought, what would I have done if he didn't answer? And I couldn't honestly answer that in that moment. And so I thought I should probably tell Christina, because Christina is like the sister that life gave me. And I can tell her anything and everything. And I know that it's without judgment. She gets it. It'll go to her grave. So I said to her, we got to talk. We both work a lot of hours and it's hard for us to connect. And I said, I don't give a shit how tired you are. I need to tell you something. She's like, oh my God. So instantly she thinks my cancer is back, right? And I'm like, no, it's not that.
Oh no.
I mean, that's probably what Chris would think if I called him up and said, oh my God, I got to tell you something. But I told her and I said, I just need you to know. I was mad at you for like 10 seconds. But see, she's been through her own mental health issues with her own family. And so she said, no. She goes, you know what? She goes, for a split second, I felt guilty. I didn't answer. She goes, but Anthony is exactly who you needed to talk to. But I had to let her know. I felt I needed to let her know in case I ever feel that way again. We kind of have this thing. Like if I feel that way and if I call you back to back, you need to answer me. Even if it's just a text to say, I'll call you in 5 minutes. I need something. And I think it's important that we all have somebody like that.
Yeah, the back-to-back calls is a big deal.
Right.
So I think it's important to be able to say to someone that you're really close to, like, hey, if I call you 2 or 3 times in a row, please, text me or, answer, even if you can't talk very long.
Yeah.
So we can set up a time later to talk. We all go through crises and we're faced with different losses, different challenges in life. So we need those people. And what I want to say too is, you guys talk about, open up, share with someone, but for those people that are receiving that information and just like, hey, try to put your judgment aside. You really just got to come with an open mind and be there to listen.
Hey, let's talk about drugs briefly, and then we'll let you go because we can come back and always talk about this. But I think it's important to talk about medication. Something you said earlier, which I loved, is you said depression doesn't always require medication, right? Now, what do you do with a patient where, in your experience, you really think that they, trying to avoid medication at all costs, but they really could use some to get leveled out, or however you phrase it? What do you say to those people who are really against medication but probably could benefit?
Well, first of all, I think it's important as a clinician that I have the open mind. I need to listen to my client and take in what they say. And the next step is really to build rapport. It's not to come with judgment, not to say things that are going to, set them off. I really want to actually make them laugh if I can, or at least put them at ease. So I kind of just read them and do what I need to do to put them at ease. And I try to reassure them, or I think I do a pretty good job of reassuring them, I'm there for them. If you don't want to do medications, then let's meet more frequently. Let's talk this out. Let's see if I can find, I'm a psychiatric nurse practitioner, and I'm usually employed to manage treatment teams, and mostly manage medications. So I'm not engaged in doing a lot of therapy, but if that's what's needed and I can't get them to a therapist because therapists are overwhelmed and in high demand, then I will spend a longer time with them.
Now, I've known people that just didn't know better and decided to take themselves off medication cold turkey and were violently ill and worse off than they ever were. So can you speak to that and how not to do that?
Yeah, absolutely. So if we decide to do a medication, I'll talk to them about their habits and, do they take medications already? Are they in the practice of taking daily medications? And that guides me to what medications I should choose. Because if they're not in the regular habit, then I'm going to choose something that will help, that I believe is going to help and is appropriate for that diagnosis. But if they miss a day, they're not going to feel so bad, or if they come off. So
everybody should do medication like that.
Well, I wish there were more medications like that, but there's very few, to be honest.
Oh, okay.
And so, I would always say, work with your doctor, talk to them about, weaning off. Don't just stop, because you can feel really horrible, like you got the flu for a few days. And some of those medications, like you said, can make you feel 10 times as worse.
And sometimes when you first start medication, is there a period of adjustment where you may prescribe a certain dosage and then it's just too much or not enough? And so would you suggest that patients really give it like 60 days or 90 days or whatever amount of time to sort of get the
Right.
dosage right for them?
Well, there's a couple of things that people need to do when they try medications. First, be consistent. Take it as prescribed. If the doctor tells you at a certain time, try to take it. If it's morning, take it every morning. If it's nighttime, take it, at night. If they say take it with food, make sure you take it with food, because some medications don't work unless you had a full meal or close to a full meal.
Mm-hmm.
And then, yes, there are a lot of medications, especially for depression, that don't work right away. They take, they say up to 6 weeks before it can be effective. Now,
Oh, I didn't know that.
the newer research is saying, hey, if they should be responding within a week or two, not fully responding. That means just a little relief. You're probably familiar with the pain scale of 0 to 10. 10's like the worst pain. I kind of use a similar scale to patients. I'm like, how depressed are you? Are you a 10? Are you a 0? Are you somewhere in between? And then I will talk to them about their specific symptoms like anxiety and try to rate that, feeling sad, hopeless, helpless. And those are all depression signs. So, we'll talk about, are you getting out of bed today? Are you showering? Are you doing that a couple of times a week where last week you weren't doing it at all? Are you sleeping any better? Is your nutrition? So we talk about all those symptoms because they'll come in. I mean, teenagers are especially, they don't really know. They haven't been on medication. So like, it's not really working. And I'm like, okay, so you've been hanging out with your friends? Or are you texting a little bit more? Are you chatting? And they're like, oh yeah, I am. So I have to really dig into their life, their routine, and even adults too, because some people just don't understand. And I tell them it's not a light switch. You don't just turn it off and on. It's a gradual improvement.
So that would be difficult for someone like me who has zero patience. So be patient, people.
Yeah.
Yeah.
Well, let me just say thank you for doing your job the way that you do it, because the way that you describe it, and I know your character well enough on a personal level that I know that you do exactly as you're describing. And it sounds like if you have to have a mental health clinician, you're a fabulous one to have.
Oh, well, thank you.
I mean, the fact that you make it very personal and you're not working on a 10-minute, get them in, get them out, I mean.
Yeah, I feel like you're treating the people and not the process.
Oh, yeah. I mean, I
perfectly
start
said.
my conversation. I'm like, well, how's it going? What have you been doing for the last month?
I think about how vulnerable I felt like when I had my episode with Anthony, and imagine Chris going in to see the doctor for the first time and having to be vulnerable and to voice concerns and feelings. And that in and of itself is like so difficult, let alone then say you work up the nerve and you go back for your next appointment and then they come at you like that. Where, okay, so how you doing? Yeah. Yeah. Okay. And to feel like you're burdening them or bothering them, or you have to hurry up and get it out and you only have a tiny amount of time. Like, that's a problem for me. Like, I need to talk.
Yeah.
Well, if you ever have extra time in your day, you can always call Chris or I up and ask how we're doing.
Girl, I might call you for therapy.
We'll have your wine glass ready. We'll have happy hour.
Right.
Well, you know what? We're going to let you go, but we're going to have you back if you come.
Okay.
Yeah.
Okay, great.
So we definitely will. And if anyone has anything specific that they want us to address, just reach out to me at thecareprojectinc.org. Just go there and hit the contact us tab, and those emails come directly to me. And then, we will talk more about this. I think it's so important. I mean, and this isn't just about breast cancer survivors and their families. This is relevant for everybody. And something we didn't touch on, which Chris, write this down. What we need to talk about is caregiver support. People like my Aunt Susan, who took care of my Uncle John, who had a traumatic injury that left him in a bed for many years, and her PTSD from that, and just the caregiver support, I think, is another major issue. And I say that because thankfully, my Aunt Susan was diagnosed early stage, and she's having a much easier time of it, if you will, although it's difficult for her than, say, some other people have. For me to sit with her is a whole different level of, it's affected me a whole different way. And I haven't really processed that yet. So I think we'll get her on too, and we'll talk with her.
Oh, that's going to be a great show.
Right? That's going to be a lot of F-bombs in that show. I'm just saying, I'm basically her mini-me, so, you do the math
It's
on
one
that
of my
one.
favorite words.
Yeah.
There
You
we
mean
go.
food, right?
Food. F is for food. Absolutely.
That's going to be a fun show.
Thank you so much, Ed. We will talk again soon.
All right. I look forward to it. You both be well.
Thanks, Ed.
Thank you. Take care.
Thank you for listening to Handle with Care, Breast Cancer and Beyond. Please let us know what you think of the show by leaving a rating and review. And don't forget to share it with a friend. For more information or to connect with Carrie, go to thecareprojectinc.org.
With Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.